Okay, hi everyone. I wanted to talk to you today about our study that we're just starting, looking at widening engagement and participation in AT cancer screening research. So it kind of follows on, building on sort of what Ramsey's looking at in her work, but we're trying to look at making it inclusive for everyone and accessible to everybody affected by AT. So we've just received funding from NIHR and the project will officially start, well, next week, July. So I just wanted to share our plans with you all so you sort of know what's going on and if anybody's interested in getting involved as well, there's sort of ways to get involved. So to start with, I'm Rupinder, I'm a research fellow at the University of Nottingham. My research interests involve making clinical research more inclusive and more accessible for underrepresented groups. I'm really passionate about making sure that clinical research is as inclusive as possible so that everybody benefits, because at the moment, sometimes that's not the case. So on the project, we also have Professor Rob Dineen, who I'm sure you're all familiar with, and he was kind of sort of the spark behind this project. And then we also have Dr. Manpreet Bains, who's an associate professor in qualitative and mixed methods health research, and she has a lot of experience with engaging with diverse communities. And then we also have Claire Gallagher, who's our PPI collaborator, who has lived experience caring for a child with AT. So just to give you a little bit of background, from the AT Society, we got some data and it shows that around 37% of people with AT in the UK are from a non-white ethnic group. And also people speak a lot of different languages. There's Urdu, Pashto, Turkish, Arabic, Polish and Spanish. And AT Society recognises that some families struggle to engage with research and clinical services due to language and cultural barriers. We want to change that. So in this project, our goals are to understand what makes it hard for families to join in research, in cancer screening research specifically, but wider AT research. We also want to work with families, healthcare professionals, researchers, and the AT Society to create better ways to invite and support people to participate and to engage. And we want to make sure that any developments in cancer screening research are fair and accessible for everybody affected by AT. So we'll be conducting a qualitative study, and we've got sort of a three-step plan. The study has three different phases. So phase one involves sort of planning together. So it involves running an online workshop with families, with healthcare professionals, researchers, and other people involved in delivery of AT research, and also involved in the clinics as well, about the best approaches to designing an interview study for people with AT, the best way to approach them, the best way to recruit them, the best way to include them. And then in phase two, this will be an interview study. We'll be looking to speak to people with AT, children and young adults, and also their parents, families, caregivers, focusing on people from diverse groups to really explore sort of what are the challenges, what are the barriers, what helps, what doesn't help, so that we can design future research trials to be more inclusive and more accessible. And then phase three involves sort of bringing it all together, again, some more online workshops, again with families, involving you all, involving healthcare professionals and others involved in delivery of AT research, to really take the learning from our conversations with people and with families and with caregivers, to sort of sense check what we found, see that it makes sense and that we're accurately representing it well, but then also to sort of develop a toolkit of recommendations for future research and for future cancer screening research, to make sure that it's inclusive and it's accessible, and we're listening to people's needs and including that in the way that we design and deliver research. So your voice really matters in this. Families are sort of at the heart of this project. So there's different ways that we're trying to involve families. There's workshops to help us design the best approaches to make our interview study as inclusive and accessible as possible for families from all backgrounds. We're working with Claire, who is our PPI collaborator, and Claire will be overseeing the project and the work that we're doing to make sure that our approaches are sensitive to families' needs. And then we want to also hear sort of your stories and ideas as well, especially for those from underrepresented groups in research, to take part in interviews, to share your experiences, what helps, what doesn't help, to take part in research, but then also sort of in terms of pulling it all together and developing that toolkit of recommendations. We want to make sure that your voice is included in this and to take it forward. So when all us researchers come along and we start designing future trials and things like that, we think about this at the design stage at the start. And through this project, I'm trying to make it easy for people to join in. So in the interview study, we'll try to have information in different languages where we can, and if needed, interpreter support as well. With the interview studies and some of the online workshops, we're looking at maybe an online approach so that you can join from the comfort of your own home. So you're not having to travel in quite far for one-to-one interviews. As I understand, everybody lives in different places all over the UK. The crux of it is we want to make it as simple and as welcoming as possible to take part. So that's why we'll be running in phase one sort of a workshop with everybody to try to figure out the best way to do that and tease that out. And what this means for you, so hopefully through this project we'll be able to identify how to better support families in cancer screening research in AT, and also through this we hope to in the future include more voices in research through this project and then through subsequent projects as well. And hopefully we'll be able to create a future where everyone with AT can take part in research and benefit regardless of their background and community. So thank you very much for listening. I'd be grateful to connect with you if you've got ideas, if you want to get involved. Please feel free to drop me an email. Please feel free to come and speak to me now as well. It's really, really important that I can learn from you so that we can design this well and run this well so that it's including everybody.